Hey doc, have you been struggling placing implants and finding the right positioning with your implants? Well, if that's you, you've logged on to the right video. Well, I want to let you know, you're probably asking yourself, like, wait a second, aren't you that third molar expert? Yes, that's me. But I want to let you know that when you place implants, it's very challenging for you to remove third molars. But if you're a GP who can remove third molars, it's like third molar surgery opens a gateway to all the other surgeries that are within dentistry, specifically implants. And the number one thing that GPs always ask me when they decide to take one of our clinical training courses is, are you going to teach about implants? Well, the answer is going to be no for me. But I want to let you know that in this video, I'm going to share with you the number one software that I use when treatment planning immediate implants or all my implant cases. And that's called BlueSkyBio. So I went ahead and I placed it in my Google search here, and we're going to go and click on it. So this is actual software that I use. It's phenomenal. You go ahead and grab the software here, click advantages. Once you get this point, you're going to go to software, click download software. And once you download the software, you could choose the Windows version or the Mac version. So I'm not sponsored by them, but I just want to give them a shout out simply because this is the type of software that I use. And if you're struggling trying to plan cases outside of your practice, this is a wonderful software that you could use instantly and get some great results. All right. So I have a case that I've already started working on, but I'm going to walk with you down the process on how I treatment plan for immediate implants. All right, let's jump to it. So here's a case right here. This patient is wanting to have an implant at site number 13. So there's different ways in which you can receive the software. You could either go in your desktop and drag and drop the software into the actual software, or you could do it manual or online. I have the old school version. I'm actually doing it on the CD. And unfortunately, I have to treatment plan it because if it were digital, I could just send it to my team and they could take care of it. But work for me, blessings for you. All right, let's jump into it. So first things first, when I'm looking at my CT scan, these are the types of cases that I'll actually end up getting. They're pretty straightforward. Don't be alarmed when you're doing it. But the first things first, I look in this screen right here, and just to give you some orientation, this is the frontal aspect, so the front of the face, the right side of the face, the left side, and the back of the head. You could see the cervical vertebrae, you could actually see the spine right here, and you could actually see the teeth that are coming around. Now I want you to see this right here. This is going to be prominent in making sure that you understand and get right imaging when you do this. So oftentimes when you open up this software, it will be shortened. And you can see how half the ramus is cut off. What you want to do is take this and pull it all the way back. All right. So in this video, I'm not going to share with you how to go ahead and get everything situated. I'm just going to share with you some little tips and tricks that I use in order to treatment plan implants instantly. So once your panel looks to be adequate, you can press this button here, and this makes it zoom it out or zoom in full screen. It allows you to see everything that you would like to see for this case, right? Here's our little toggle bar to determine exactly where we are in the mouth. And it's going to be tooth number 13, which is broken off. You can probably see it right there a little bit. So I'll zoom out. And what I want to do is orient my toggle button here over the tooth. And I'll come over here and I'll go right up to tooth number 13. Once I get to tooth number 13, this is cross-section view that I typically like to use for treatment planning. And I'll go here and I'll zoom in and I'll see what is the tooth, or where's the tooth that I'm actually working on, right? So here's the eye right here. So just kind of give you a heads up. Here's the sinus of the nose right here. Lower jaw, upper jaw, here's a tooth. So this little button right here allows me to rotate in the area or highlight the area that I want. So that's a tooth right there, and it looks like we're going towards the midline because this is the nose, and you can see the incisors that are popping up. So we want to go back to where we were. That looks like the cuspid. That looks like a premolar. This looks like the second premolar. It's broken off, and then here is your molar, and you can see the two roots that are there. It looks like there's some infection there that needs to be addressed. And we'll put that on a treatment plan for the patient. The good thing is this, as a GP who just does IV sedation, third molars, and implants, all I get to do is focus on a couple things. Now, you GPs probably doing a whole lot more than I have to, so that's why I decided to focus in my practice on just those 3 items. But we're not here to talk about that, so let's jump into it. So now we know where our area is. We see some infection present, but we also, the doc that is planning wants us to treat this patient. He said, we want to implant at tooth number 13. So I typically don't always get implants, CT scans for immediates, because if the tooth there, that means 90% of the time there's going to be bone that's present. And I believe that if you are going to place an implant, place it as soon as the tooth extracted, as long as you have enough primary stability. All right. So here we are. We could see here that the tooth is basically cut off right there. So it's a root tip, and we have good buccal bone present right there. We have a good amount of space in between. So let's go ahead and measure it out and kind of show with you some tools. You could have your distance measure, click it once, click it twice. So we have a good 8 millimeter width. So if we were to put a nice size implant, like what is it? Like a 4.5, we have plenty of space circumferentially all the way around. All right. So we get that out of there. Didn't want to show you that, but whatever. It's all about learning. So I'm just going to go ahead and delete these out, or just move them out the way so I don't have to be bothered with them anymore. All right. So now that we have these measurements out the way, what I'm going to do is I'm going to go ahead and remove these measurements out the way so you can kind of get an idea of what we're going to be doing. So the shortcut way about it, because that's why you're here.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now, and let's embark on this exhilarating journey together.
Is to simply just go into implants. All right. So add implant, implants, go to add implant. Once you go to add implant, I use Nobel Biocare. Not getting sponsored by them just yet, but I use Nobel Biocare, and my standard implant size that I place is a 4.3 by 11.5. And so since it's a maxilla, I'll go to click the maxilla. If it were like Brandmark tile Unite, then I'll click it. But if not, I'll go to my Noble Active, get my platform, which is the diameter, click on 4.3. And then what I'll do is this, I'll go to the length, and I'll see that the length's coming 8.5 to 18. We're not doing it that big. So this is my go-to. So I don't even try to measure with the ruler like I did earlier. I just go to my default implant, and it's going to be a 4.3 by 11.5. So once I get that implant, you see that the little implant add button is present. So we go ahead and drop it in the site. All right, now we have the implant. We see that it's sitting out in the sinus and outside the buccal plate. So we just want to orient this in the right area that we want. And you could see here that this tooth has is pretty large, and it actually mirrors the same width of the actual implant that we're actually working with. So the good thing is this is that we don't have to do any extra careful surgery. We could actually take this 11 and a half and make it to 13 and still have plenty of space. But the way in which I place immediate implants is that I want to be 2 millimeters below the cervical margin of bone that's present. So I'll go ahead and place it right here, and I'll place it more palatally because you're going to have some bone loss anytime a tooth is taken out towards posteriorly and inferiorly. So as you can see, I'm really a good far amount away when I'm planning. Now, once I get clinically, it's going to be completely different. So as you can see now, I am in a good space and buccal lingually. All right, so this is a buccal, and this is the buccal palatally, I should say. So what I'm gonna do is this: I'm gonna come over here and check to see if I am circumferentially all the way around with the implant. So I'll go ahead and go up because this is where this blue line is where this cutoff is, where this implant is, right? So we'll go ahead and zoom in, and we see that we're right here. So I'm gonna move this out of the way. Oops, now I grab the implant. So put that right there, and we'll slide this out of the way. And what I'm gonna do is this: I'm gonna pause the video for a second and I'll remove this out, and I'll show you how to do it. All right, now that I figured it out, you go to view. I don't use this too frequently, but go to view. We'll turn it off and on, I should say. You go to view and go to cross section projection and click that button, and now it's gone. So what I'm gonna do is this: you're gonna see this blue outline is the actual implant. So here's the buccal and the palatal bone, and we just want to make sure that we're 2 millimeters buccal, lingual, mesial, distal, so we're not close to any teeth. And so what we're doing is we're working our way towards occlusal, and then the implant's gone. So as you can see, here's the maxillary sinus starting to approach the present at that area. And so what we're going to do is this: we're going to go ahead and work our way coronally towards the crown. So which means we're going from here down, and we just want to make sure that this implant's completely encased in bone. And so you can see the implant should start getting larger and larger and larger till it's no more. So right now we're at the occlusal surface. And how can we determine that? We'll go here and turn our projection back on, which is go to back to view, 2D, and that cross section. And you could see that this is where we are. Let me put a couple more views on so that we could see everything. All right, there we go. So we have that blue line, and it lets us know that we're right at the alveolar crest of bone, and I'll zoom in right here. So that's why the implant actually ended up zooming out. Bottoming out, because you don't see it anymore. So that's how I go ahead and I treat and plan my cases, and it's really straightforward. This video is a little bit long because I'm explaining everything, but essentially what you want to do is once you find the area on your CT scan, just go ahead and get your default implant. It could be a 3.5 and 11 half. It could be a 4.0 by 10. But for me, I like a 4.3 by 10 and 11 and a half. That gives me good girth of width and length. And by being able to have that default, you plug it in and just plus or minus millimeters in terms of length or plus or minus millimeters in terms of width, and you're good to go. And that's how I keep my treatment planning of immediate implants pretty straightforward. All right, Doc, so if you like that video and you appreciate it, hit the comment button, tell us what you liked, hit the like button, press subscribe, and share all this information with all your colleagues that are wanting to take their implant skills that next level. And then, oh, by the way, let them know I'm the third molar expert. All right, guys, make it a great one. Hey, I bet you're wondering, why are you making a video about implants when you're the third molar expert? Well, A GP asked me to. Simple as that. But I want to let you know, if you're faithful over a few things, you'll be made ruler over many. Make it a great one.